So mood charting versus tracking sheet or diary card, okay? I don't always use the diary card, the DBT tracking sheet. The reason for that is because I don't want to overwhelm people with paperwork. And as you saw, the diary card, I'm just going to refer to it as the diary card for DBT purposes. The diary card is pretty comprehensive, right? It is fairly short form still, but the mood chart is much shorter than the tracking sheet. It is less comprehensive, so I don't get as much data from my client. But when we're getting into treatment, that's not always the end of the world, and I'd rather get some data than everything. Sometimes it's also just not as important to have that whole comprehensive look at what's going on as you know, getting somebody with bipolar disorder more stabilized with their mood. So the mood chart may be very sufficient for that. Just checking in for any questions. I know you've been fairly quiet. I just want to keep my eye on the pulse here. We're about 12 minutes away from break. Okay, not seeing anything, so I'm going to move on. DBT is based on a dialectical philosophy, of course, as the name implies, right? By the way, just a quick little chuckle about that. Often in group, clients will, amongst themselves, come up with a new name for dialectical behavior therapy, which is known as diabolical behavior therapy. But it is dialectical behavior therapy. Dialectics is a whole world philosophy that academics can spend a lifetime studying or a career time studying. So what I really try to do for my clients and for myself, and for when I'm doing trainings like this, I try to really, all right. The next skill we're going to talk about is non-judgmental stance. This is one of my favorite skills. And this can be a very quite a complicated skill. This is a skill that is really about semantics. Okay, so when we think about judgments, think about right and wrong and good and bad and stupid and ugly and ridiculous and crazy and so on. Okay, so judgmental language. You can also use the word inflammatory language. You know, so swear words, calling people idiots and morons and jerks and all of those kinds of words. So inflammatory language. The language that we use actually does have an effect on our emotions, right? So the idea with the skill, what I like to do then is check in with my client. What do you do already to help yourself cope in more effective ways? So you have an urge come up. What do you do sometimes? Because you don't act on the urge every single time the urge comes up. What do you do sometimes when you notice that urge? And then we write down those things. This is really important, is having the client make a list for themselves of skills. At the top of that list, by the way, should be at least one of those F-tip skills. Do a forward bend, tip the temperature of my face, intense exercise, paced breathing, okay? And then we want them to write, what do they do already? Even though they do it already, it still needs to go on the list, because it's really hard to think straight when we get into emotion mind. And we don't want people to have to think about, what can I do to help myself right now? They can pull out their list, and their list tells them what to do. Do a forward bend. So that's what I do. And then the next thing on the list is